Hi, I'm Dr. Nancy Ann Shipley. Shoulders are one of the most complex and mobile joints in our bodies, which is why they're so prone to injury. In this series, we're going to explore common shoulder issues, from rotator cuff tears to arthritis and labral tears. We'll cover the basics of what they are, how we treat them, and where regenerative medicine might fit in. Stick around if you're dealing with shoulder pain or just want to learn more. Let's talk about the rotator cuff. Rotator cuff injuries are some of the most common shoulder problems, especially in athletes and those over 40. The rotator cuff is a group of muscles and tendons that stabilize your shoulder joint. And when these tendons are torn or inflamed, you might feel pain or weakness when lifting your arm. Treatments range from physical therapy to regenerative medicine, and for more significant tears, surgery may be necessary. PRP or other regenerative medicine treatments can often help with the pain and healing for smaller or partial tears. Let's talk about shoulder impingement. Shoulder impingement happens when the tendons in your shoulder get pinched or irritated as you lift your arm. This often leads to pain, especially with overhead movements. Impingement is common in swimmers and tennis players, but it can affect anyone. Treatments include physical therapy, anti-inflammatories, injections, and sometimes platelet-rich plasma or other regenerative treatments to decrease inflammation. And if conservative treatments don't work, sometimes surgery is indicated to create more space for those tendons. The AC joint, or otherwise known as the acromioclavicular joint, sits at the top of your shoulder, and it connects your clavicle or the collarbone to your shoulder blade, or otherwise known as the acromion. With AC joint arthritis, you might feel pain on the top of your shoulder, especially when reaching across your body. Non-surgical treatments like physical therapy, injections, and regenerative options can be very effective for these conditions. But in some cases, a procedure called a distal clavicle excision may be required to relieve pain and restore function. The glenohumeral joint is the main ball and socket joint of the shoulder. When arthritis develops here, it can cause deep aching pain, stiffness, and loss of motion. Early arthritis can often be managed with physical therapy, joint injections, and regenerative treatments like PRP or stem cell treatments, whereas in advanced cases, a shoulder replacement might be necessary to restore function and reduce pain. Let's talk about the biceps. Biceps tendonitis is an inflammation of the tendon that attaches your biceps muscle to your shoulder. This can cause pain at the front of your shoulder, especially with lifting or reaching with your arm. Rest, physical therapy, anti-inflammatories, and injections are common treatments. And PRP injections can also help by delivering healing factors directly to the tendon. But if it becomes a chronic issue, surgical options may be considered, such as a biceps tenodesis, where we actually cut part of the tendon and reattach it, or a biceps tenotomy, where part of your biceps is released. Let's talk about the labrum. The labrum is a rim of cartilage that stabilizes the shoulder joint. It's a structure that encircles the cup of the ball and cup joint. A labral tear can cause pain, sometimes clicking, and instability in the shoulder, especially in athletes or after a fall or an injury. Conservative treatments include rest, physical therapy, and regenerative medicine like PRP. But if the tear is significant, it may require arthroscopic surgery to repair the labrum to restore stability and improve pain. Let's talk about shoulder instability. Shoulder instability occurs when the ball of the shoulder joint slips out of socket. This can happen after a dislocation or if the ligaments supporting the shoulder are too loose, leading to frequent popping or dislocations. Physical therapy and strength training are often the first steps to help stabilize the shoulder, but for some patients, surgery is required. It may require a repair of the labrum, which is the cartilage surrounding the cup, or a tightening of the ligaments that support the shoulder. Let's talk about shoulder separations. A shoulder separation is different than a shoulder dislocation. This is an injury to the AC joint, at the top of the shoulder and is often from a fall or direct impact. This leads to pain, swelling, and sometimes a visible bump or deformity at the top of the shoulder. Many of these separations can heal with rest and physical therapy, possibly even regenerative medicine to speed up healing, but more severe separations might require surgery to stabilize the joint. Let's talk about shoulder replacements or total shoulder arthroplasty. These replacements can relieve pain and restore function for severe arthritis. And there are two main types of shoulder replacements: an anatomic, where we replace the ball with a ball and a socket with a socket, or the reverse, where actually the positions of the ball and socket are switched. Anatomic replacement is usually for those who have an intact rotator cuff, while the reverse is a better option if there is a significant rotator cuff tear that can't be repaired. Each of these approaches have unique benefits, and your surgeon can help you determine the best fit. Let's talk about regenerative medicine. Treatments like PRP or platelet-rich plasma, MFAT, which is microadipose therapy, and BMAC, which is bone marrow therapy, offer exciting options for shoulder pain. These treatments use your own cells to reduce inflammation and support healing, making them ideal for rotator cuff injuries, tendonitis, arthritis, and more. They're a great solution if conservative treatments haven't quite been enough, but surgery isn't quite the answer. Thanks for watching this series on shoulder injuries and conditions. Remember, early diagnosis and the right treatment can make a huge difference in recovery and performance. So if you're dealing with shoulder pain and you want to explore your options from conservative care to regenerative medicine to surgery, give us a call and visit our website. Don't let shoulder pain hold you back. Let's get you back to doing what you love. I'm Dr. Nancy Shipley. Thanks for watching.